So we are talking about we're finishing our hormone series for this month, and I just finished a whirlwind series, talking a lot about stress. So today I'm actually going to be talking about how stress can affect the testosterone or male hormone there, right? And so the title for today is Can Stress Affect Your Testosterone Levels? And we're going to cover 3 points. I'm going to talk a little bit about what testosterone does in the body and what does it look like if we have low testosterone. And then we're going to answer the question, does stress impact your testosterone levels there? Okay, and welcome. For those who don't know me, my name is Dr. Jeffrey Lee, and I'm both a naturopathic physician as well as a registered acupuncturist. And what I love doing is I love studying the ancient, Chinese medicine and a lot of just ancient traditional medicines. And I also love to read and study a lot of the cutting edge science, like a lot of the new things. And I'm really fascinated with neuroscience, with a lot of brain health. And so what I do with a lot of my patients is I combine the best of both worlds and I personalize treatment plans for each of my patients. So I do treat a lot of men in my practice with testosterone issues or, low sex drive or low libido. And surprisingly, I have a different treatment plan for every single patient because the root cause is always different. So I want to make sure that I spend a couple moments explaining that. And so let's start unpacking this. And if any of you have questions or any comments, feel free to write them in. I'm happy to answer it. And before I get started, I just wanted to thank all of you for participating in my online stress quiz. It's howstressedareYou.com. And I've received awesome feedback. Thank you for all of you who've taken the quiz and you've benefited from those free PDFs there, where it just gives you a little bit of information on how to avoid stress and how to handle stress. So thank you so much for all of your feedback there. And I also just last week I finished my very first webinar on stress. And so that URL is ultimatestressreduction.com. And my replay is still up there for all of you, so please check it out. It's a free 1-hour webinar, and I share with you actually a lot of practical tips on lowering stress levels. So you're welcome to check that out, and I'm going to be launching my course in the next 2 weeks. So I'm busy preparing for that, and I'm excited to work with many of you who are going to be doing that course with me. So I just wanted to say a quick thank you for all of you. Now, okay, so today, again, let's recap. So we're going to talk about, can stress affect testosterone levels, and what does testosterone actually do in the male body, and what does low testosterone levels look like, and does stress impact your testosterone levels? Okay, so this is for testosterone. So this is the male hormone. Now, it actually exists in both male and females, the testosterone hormone. But for today's Facebook Live, I'm just going to mainly focus on the male anatomy or the male physiology. So testosterone is very important for right around puberty. So what happens with testosterone in puberty? This is when you see an increase in the surge of testosterone, and it's very important for growth for these young males. So you'll see facial hair, you'll see body hair, pubic hair, a deepening of the voice there, the more growth in terms of body mass, muscle mass, but also more growth in the penis and the testicles there. And then a lot of more bone strengthening. And often you'll see height increase around that time. So that's around puberty, and testosterone is very, very important around puberty. Now, after puberty, for most adult men, testosterone is still very, very important. And I don't know if any of you can remember back, I think it's maybe about 3-4 years ago, where testosterone was talked about a lot in the media. And that was around because a lot of I think it was Sylvester Stallone, Rambo, a big tough guy. I think he probably came out with a movie there, and people are wondering how does he still get so big and buff around that time? And it turned out that he was actually injecting with synthetic testosterone. So I think that was a lot of people are asking questions around that time. So what does testosterone do for men? It definitely increases muscle mass, it increases strength, and it definitely aids in growth there. It also helps with bone density, and that's very, very important. There's a difference why you hear osteoporosis or osteopenia more in women, where men often with testosterone levels that's protected. Testosterone for men also is important for fat distribution. So it's interesting, some of my patients who have lower testosterone levels, we sort of see this fat distribution. Maybe it's more, they can center around their abdomen there, or they can gain a little bit more fat mass there. And then definitely we know that testosterone affects sperm production and especially libido or sex drive. And that's why I think a lot of men, the two reasons why a lot of men will see me in my practice is because they want to gain more muscle mass, feel a bit more masculine, but definitely because of lower sex drive there. Because as we age, naturally testosterone levels come down. Now the question today is, does stress cause the testosterone to come down, lower a lot quicker? So we'll unpack that later. Now, what are signs and symptoms of low testosterone? Now, patients that come in with low testosterone, or a lot of the older men, they'll complain of low energy. They'll complain of depressed moods. Sleep issues can be tied into lower testosterone. Definitely got kind of lost in muscle mass, or they started working out but they just can't gain muscle mass. Definitely that low sex drive. And then I also hear a lot of men just worried about the inability to have an erection as well as maintain one. And then that low sperm count. Like those are all tied into lower testosterone. And pay attention to some of those symptoms there, because they're awfully familiar, especially things like the low energy, sleep issues, depressed mood. That's very similar to to having a lot of stress in their life as well. And we'll talk about that as well. But I think one thing that's actually very important is to understand is not all men who have low testosterone ends up with the symptoms that I just mentioned. And that's a very important take-home message, because a few years back when I saw a lot of men coming in with, they would want their testosterone levels tested, and they came in with all these symptoms. And actually a lot of them did not have very, very low testosterone. In fact, they had a sort of age-appropriate testosterone, yet they had a lot of these other symptoms there. So I just wanted you to keep that in mind as well. Now, other health concerns related to lower testosterone, and this is something that I want all of you to be aware of. I see this in obesity. So some of patients who are really struggling with a lot of obesity, that can actually cause issues around testosterone, lower testosterone. Lower testosterone can actually lead to other issues like type 2 diabetes. And there's a lot of research that shows heart disease can be affected by low testosterone. And then also cholesterol issues. So again, keep all of that in the back of your mind there. Now, the main question is, and what I want to address is, does stress impact your testosterone levels? And like I said earlier, low testosterone and high stress, they share like a lot of common symptoms. What I see in my practice is that loss of interest in sex or lower libido definitely is tied into both high stress and low testosterone. Fatigue, low energy, depression-like symptoms like the blues there, that is also associated both with high stress as well as low testosterone, and then sleep problems as well. So let's kind of unpack that a little bit. So a lot of the research does show that when we are in survival mode, when we are under high stress, you've heard me say this many times, that we're in that fight or flight, right? We're in that survival mode. And what happens is we release a lot of cortisol. And cortisol it can compete with other hormones in the body. And there is research that shows that high cortisol levels, there's a correlation to lower testosterone levels there. Now, one important thing to really figure out is, does high cortisol, because you're under stress, does that cause low testosterone? Now, just because we see a correlation doesn't mean that there's a cause there. And in fact, the research, we're not sure about that. We're not entirely sure with what we're studying that in the research, that if we reduce stress, does the testosterone levels always come back up? Not necessarily. So there's still, in this field of study, there's still a lot to understand and a lot to learn here. But I want to share with you maybe clinically what I've done with a lot of the men in my practice, where we have actually improved testosterone levels, but I'll kind of do it hand in hand with managing stress there. Because we know that stress, hands down, we know in the research, it has a lot of other physiological effects on the body. It really kind of throws the body out of balance. And if you watch some of the previous Facebook Lives, I've talked more about how cortisol impacts immune system. Cortisol impacts, focus and how the brain functions. So there's a lot of things that cortisol, like too much cortisol, is tied into such an imbalance in the body. Now, what I've done with a lot of the men in my practice there, and I've kept it actually quite simple, because if we can do some of the basics there, I've seen testosterone levels and some of the symptoms of like low energy and depression, I've seen that really kind of change over time. So now, a lot of men will ask me about, no one really comes asking like, come and measure my testosterone levels. Usually it's because of, the sex drive or sexual function or performance there. So some of these tips that I'm going to share with you right now, this is what I've observed in my 15 years of practice that can make a big, big difference there. So one thing that I have seen improve maybe libido, the symptoms associated with high stress and low testosterone is, number one, is consistent exercise. I know I'm sounding like I'm repeating this over and over again, but if you really dig down into the research with exercise, consistent exercise really improves usually libido and just overall health for men. And what I mean by consistent exercise is really getting out there and 3-4 times a week and having a good workout. I've talked about the difference between high intensity exercise as well as or more of kind of lower intensity walking there. It does show that higher intensity, it releases more, remember I said BDNF, brain-derived neurotropic factor, but there's actually a lot of amazing chemicals that gets released when you're doing short burst, high intensity exercise. So that's what I encourage a lot of the men in my practice to make sure that they do. So number one, make sure you have consistent exercise there. Number two, this is not, now I've been in practice for a long time, and 15 years ago, smoking was a bigger deal. Like, people could smoke in restaurants, not so as much anymore, but I still have seen a big transition or big change when I guide my patients into stopping smoking. I have found that their health, their libido actually improves by stopping smoking, as well as minimizing drug use. Now, this is becoming a little bit more popular right now with cannabis that's legalized. I have had some younger men in my practice, maybe when I say younger, maybe in their 40s and stuff like that, where we've seen the impact of too much marijuana or too much cannabis has affected their sexual performance. So that's something that I'm encouraging. So my point number two is stop smoking, reduce the drug use, as well as reducing alcohol. Once you get that out of your system, that also can make a big difference. And I've seen actually, like, some of my patients within a month, they've noticed, a lot of changes in their sexual health there. Now, the third thing I want to mention is weight loss. So obesity really does throw an imbalance in a lot of hormones. And in fact, other doctors have talked about it at Brio, where extra fat in your body, like in medical school, I didn't learn it as this, but when I came out of medical school, we actually now consider all the excess fat tissue in the body to be sort of like an extra endocrine system. An endocrine system means an extra hormonal system. So the more fat that we have on our body, on our frame, the more it kind of contributes to this confusion in our hormonal system. We're having more hormones than we actually need, right? Because fat tissue produces excessive hormone. So this third point is weight loss. And again, I have seen this probably one of the biggest changes when I can guide a patient through a weight loss. And I usually see for my men who are maybe a little bit more obese, once I see like a 20-pound weight loss, I really see an improvement in libido. We've also seen some improvements in other hormone balances. Now, part of weight loss is also eating a healthy diet there. So definitely eating a more whole foods diet, higher protein, higher good fats there, and definitely a lot more complex carbohydrates, which leads to a lot more vitamins and minerals. All of that is always good. So again, my point number one is consistent exercise can make a huge impact there on lowering stress levels, but as well as improving hormonal balance for men. Avoiding things like the smoking, the drug use, the alcohol, and I'll throw caffeine in there as well. I've definitely seen some of my patients when they've cut down on their 5-6 cups of coffee and cut it down to 1, that can improve their hormonal balance and their sexual health there. And then number 3, I've really seen a big change when it comes to weight loss there, because you're getting rid of excess kind of fat cells that produce more hormones there. But also the fact of losing weight, helping my patients eat healthier, eat a more balanced diet, that has significantly improved hormone balance there. And definitely stress. So as I'm wrapping it up right now, if anybody has more questions, feel free to ask that. But just want to wrap up saying that testosterone, what it does in the body, how it helps, men who are in puberty or who are, adult men, how it affects their libido, muscle mass. Also, so that's how, that's why the hormone is so important for men. I talked a little bit about signs and symptoms of low testosterone there, where we are having lower sex drive there, other issues around fatigue, low energy there. And then lastly, I just shared with you some very practical tips on improving your testosterone levels, improving the hormonal balance, and also improving that impact that stress has on your body there. So again, regular exercise, avoiding things like the smoking, the drug use, alcohol, and as well as weight loss there. So excellent. I hope you found that helpful there, and I think I'm still very open to sharing a lot more about stress and how stress impacts health. And I thank you for this question on testosterone. I got a couple of emails about that, and I'm glad I got a chance to just to speak on this. And eventually I'm going to get our blog out, and I'll get into a little bit more details there. And thank you again for participating on my howstressedareyou.com online quiz. And for those of you who haven't done that, please take that quiz. It just helps kind of help you figure out where you are on this continuum of stress there, and it gives you some practical tips. And again, please share that with your friends and family. So again, it was fantastic just touching base with all of you, and I look forward to seeing you again soon. Take care.